Welcome. How are you?
Hi, Willie.
Yeah.
Thank you for your kind introduction.
Hi, we would like to
just-
thank you for spending out your Thursday evening with us, Dr. Toh.
Yeah, of course. Thank you as well for inviting me for this event as well. Yeah.
And okay, Dr. Toh, when it comes to prostate health, there are numerous information that we would like to know more about. For example, I was asking, Dr. Toh, when it comes to prostate health, there are numerous information that we would like to know more about. For example, what are the causes of common prostate problems? What are your thoughts on this?
Okay.
If you allow me, I can start my presentation and I can go and explain it in details after that.
Oh, okay.
Yeah.
I'm very sure our audiences are already very eager to find out more regarding our topic today. So therefore, I will pass the floor to you, Dr. Toh.
Okay. In the meantime, I think there are some of the audience here have need to mute the audio so that there will be no any noises at the background. Okay, good evening, ladies and gentlemen. Thank you again for having me for this Protect Your Prostate Health event organized by the hospital Pantai Ampang as well as the caring pharmacy. I'm a consultant urologist in the Pantai Hospital Ampang, and here are my presentation that I would like to focus on what are the common causes of the prostate problem and what causes prostate problem, what symptoms causes prostate problem, when to see doctor if you have symptoms, what are the steps to better prostate health. In case you have any question, you can always write it in the chat box, then we can answer one by one later on. Okay, first, what are the common prostate problems? Prostate gland is a gland that's situated at the base of the bladder in a male and is actually functional as a sexual where it gives nutrition for the sperm during the productive age. However, as we grow older, this function doesn't serve much more. However, it causes more problem for the aging population. And 50% of the men will have some prostate problem after 50 years old. And what are the prostate problem entities that we have? Is like, if at all you have a medical checkup, turn out that you have done the ultrasound and it shows that the prostate enlargement. Actually, prostate enlargement is quite common for people who grew older. But it's not a problem unless it causes symptoms to you. The symptoms are such as lower interest symptoms where these bothersome symptoms is either obstructive symptoms where it obstructs you from passing urine, or storage symptoms where you can't store urine in your bladder. You have to frequently visit the toilet or urgently have to find the toilet if you have a feeling to void. Whereas the BPH is the always people have been misused this term, which nowadays we rarely use in terms of our career as a urologist. This benign prostatic hyperplasia is mainly a histopathological diagnosis. If at all you have an enlargement, have a nodule of a PSA high, and you have done a biopsy, turn out to have no cancer but only hyperplasia, then we name it benign prostatic hyperplasia. Excuse me. Whereas those patients who have enlargement with the obstructive symptoms, we label them as a benign prostatic obstruction. And of course, there's another problem, which is a prostate cancer. Next, I would like to explain what causes prostate problem. As we grow older, prostate gland enlarge. It is believed to be linked to hormonal changes as a man gets older. As you can see, this is the normal prostate gland, and as we grow older, this prostate gland enlarge, and it causes numerous problems because of this enlargement, obstruct the urinary flow through the bladder out from the into the urinary urethra. Next is prostate cancer. It's found that it's an increasing incidence in Asia. Possible is because of the aging population. or westernization of a many Asian diet with loss of protective factors such as a low dietary fat, isoflavonoids in soya beans, polyphenols in green tea, lycopene from tomatoes, or possibility because of a better reporting of cases and increases use of a serum PSA, prostate-specific antigen. And these are the risk factor for prostate cancer. If you have a family history, there are 2 times relative risk compared to the normal population, such as a first-degree relative, your parents, or your siblings. If they are diagnosed less than 65 years old, it is more of a genetic problem. And if you are older, as more than 65 years old, there's a higher risk, or if it's African American. How about the symptoms causes prostate problem? These are the symptoms that I have mentioned briefly just now. They are actually divided into 2 symptoms. One is the obstructive symptoms, where you have a difficulty to void, such as a hesitancy, where when you begin to pee, is actually very, you have to wait very long. Or intermittency, where during the peeing, you have to sort of pee, stop, and pee again. Whereas weak flow, that means the stream is very slow, or straining in the sense that you have to use your abdominal muscle to push the urine out. Or at the end, you feel like you actually haven't emptied your bladder completely. Whereas in these storage symptoms, they are such as frequency, means you have to visit toilet frequently, maybe less than 2 hours, you have to visit more than once. Or urgency, like normal people, if you have urge to pass urine, we actually can hold for a while. But for people who have a storage symptoms, once they have this nature call, they have to find toilet immediately. It's a kind of a troublesome symptoms for the patient, especially if they are stuck in the traffic jam or having a very important meeting. Nocturia means they have to void more than once at night. And dysuria is a painful during urination. Okay. As I would like to tell you that why is it this lone tract symptoms is important is because it's not because only due to prostate. It could be due to various causes such as a stone in the urethra, or even ureteric stone, means that there is a tube in the connecting between the kidney and the bladder, or there is a tumor, or there's a stricture, infection, or there is some other overactive bladder symptoms as shown in this. Okay, some people may ask, is there any correlation between prostate enlargement and prostate cancer? Or make it, the other thing is whether there's any correlation between lower urinary tract symptoms and prostate cancer. The answer is no. Okay, have to remember that enlargement doesn't mean that you have cancer. However, you need to further undergo medical checkup to rule out prostate cancer if you at all you're having any risk factor, or happen that you have done a prostate-specific antigen show that the value is abnormal. The second thing is when to see doctor if you have symptoms. I will suggest that for those patients who is 50 years old should undergo screening for prostate problem. If at all you have any symptoms, you can come at any age, because our purpose is not only to rule out if there is any prostate enlargement causing you to have symptoms. We have various causes that we have to diagnose or rule out before telling you that symptoms is actually fine. If you are come to see us, these are the various examination that we will do for you. These are the guidelines that we have. We have is European, and then American, and Asian guideline as well. And those are the recommended or optional according to our practice. I will explain to you one by one. In terms of a history, of course, we have to get the medical history to see you have any other associated problem can lead us to diagnose your problem. And one of the one of the score that we usually will do is an international prostate symptom score, which we will grade you according to your lower tract symptoms to see whether you're actually having a mild, moderate, or severe symptoms. And this helps us to know whether you actually need treatment or not. Most of patients that if you happen to come for screening, probably you have some prostate problem and you just have a mild symptoms. A lot of time you actually doesn't require any treatment, but watchful waiting. In case that you might in the future having a symptoms which is worsening, then you can come and see us back again. Excuse me. Examination will include the general and abdominal examination. And the most important part is a digital rectal examination where we will insert our finger into the rectum to feel the prostate gland. If any abnormality in the prostate gland, we will feel through our palm of the finger to feel if there is any nodule or anything to suggest that your prostate is abnormal. At the same time, with this examination, we can also estimate the prostate size as well. Investigation that required, including the renal profile to see if there is any the function of the kidney, because some of the prostate problem, it can actually cause obstruction and leading to renal impairment. And this renal profile will help us to see if there is any problem with that. Also, we will do the urine examination and culture. This will help us to check whether you have any infection. Also, to see whether you got blood in your urine as well. If there's blood in the urine without infection, that actually triggers us to investigate further to see whether you actually having any cancer in the urinary tract. And the last but not least is a PSA. It's a kind of opportunistic screening if you happen to come and see a urologist to see whether you have any prostate cancer. Next is a Uroflowmetry. And this actually, we ask a patient to walk into a Uroflowmeter and we can see whether your flow is weak or not. A normal Uroflow should have a curve which is a bell curve. Abnormal flow is something like a very short curve, and then it's very long duration of a urination. And this gives us a suggest or tell us that there is some problem with your urination. Next is the ultrasound KUB, which we can do in the office. It is very safe, fast, and there's no radiation. And this can help us to diagnose if you have any stone, any obstruction that leading to the swelling in the kidney. And all this can help us to, or even you can tell us whether there is a tumor in the kidney or bladder as well, as an opportunistic screening as well. The next is a flexible cystoscopy. It's an endoscopic procedure, which is very safe and is under local anesthesia. And it's not to be done to all the patients unless your urine shows there is a blood that we need to investigate if there is any tumor in your bladder. And the next one is a biopsy of the prostate gland. Okay, and this will be indicated only for those patients which is a PSA more than 4 or digital rectal examination findings which is found to have an abnormal like a nodular prostate to suggest that possibility you are having a cancer. There are various ways of us doing a biopsy. These are the method that commonly done by the urologist, and me as well can be done in the hospital. And it's a daycare procedure where it's done under local anesthesia. We call it transrectal ultrasound prostate biopsy. Is basically we have to put the probe, enter through the anus, the place where we pass motion, and from there we will do a systemic biopsy where we take 12 core biopsy from each gland of the prostate. There is a problem with this biopsy is if it happens that this tumor is outside the schematic 12 core biopsy, we may miss the tumor. Therefore, if we do this biopsy or any of the other type of the biopsy, if it's negative, doesn't mean that necessary that you definitely no cancer. If your PSA is high, we still have to continue to follow up with you. The next is a transperineal biopsy, and this is more sophisticated, and it have to be done under general anesthesia. Some center may do under local anesthesia. This is a grid that we will put in the perineal region, where after under the general anesthesia, they will be putting in the lithotomy, where both of your leg is actually lifted upward to expose the perineal area. Is an area between your scrotum and the anus. And this biopsy is sort of a saturated biopsy. As you see, actually is taken a lot more core from the prostate gland, so that it reduces the chances that we miss the tumor. And the next one is a fusion biopsy, where it is much more, latest technology, where you undergo MRI, and the MRI will be reviewed by the radiologist to tell us where is the possibility of a prostate cancer in the prostate cancer. And from there, they actually will mark the prostate gland, and during the procedure, it fused with the real-time ultrasound with the MRI image. Once it's fused, this will be the target lesion that we are actually going to take the biopsy. As you can see here, normally in this fusion biopsy, the systemic biopsy will still continue to take, but they will actually also focus on the area that is a possibility of a cancer and target at this cancer at this position to take more biopsy. Whatever it is, all this biopsy can help us to reach the diagnosis to confirm that you are having cancer. But in case that the biopsy turned out to be no cancer and your PSA is high, I will advise you to continue to follow up with the PSA, because if let's say the PSA is going upward trend, that is a possibility that you are actually having a cancer that required further biopsy. If not, if your PSA remains around the same range, probably it can be monitored further. And why is it important? First is to relieve the symptoms that you have. Why do you need to suffer? Prostate enlargement that causing the symptoms is not part of the aging process. You doesn't need to stay, to live with the symptoms. Actually, you can relieve the symptoms by either taking the medicine. If cannot, you can do surgery. Or the other thing is to what are the complications? Urinary retention, one of the commonest complication if you have a prostate enlargement. As you can see, this is a normal prostate gland, and as you pass urine, this urine will flow out. However, if your prostate gland is enlarged and it grows inward, it's actually causing the obstruction this urine to flow out, and eventually it can cause retention. And why this retention is because after some times the bladder is become failing. Why is it so? Because they have to work very hard for a very long time. If you can understand, actually, for normal people, our bladder is an autonomic kind of working automatically. It means if we relax, the bladder will contract automatically, and then the urine will be void without us knowing it. But as you age, your prostate gland is becoming sort of enlarged. This bladder have to work harder. Up to a point, the bladder stop working and refuse to work, then it become a bladder failure. And because of this bladder failure, they have a urine retention. Depending on how much of a urine, they can cause us an infection. Or if too much of a urine, which a lot of salt in the urine, eventually they can form stone as well. And what worse is, if let's say there is a high pressure built up in the bladder, it can backflow into your kidney and causes what we call obstructive uropathy, and it causes a renal impact. And if we didn't detect early, it can cause kidney failure. And the other thing is hematuria, means there is blood in the urine. This is the ultrasound image of kidney showing there is a gross hydronephrosis, means the kidney is swelled very badly. Okay, as you can see, normally we're not able to see all this cavity here. This is all the urine stagnant inside the kidney. And if we see this during our assessment, most of the time we will advise you to put in the catheter until the surgery is done. If not, there will be progressive renal failure, and worse, it will come an end-stage renal failure in which you need to do dialysis. Okay, what are the treatment for a symptomatic prostate problem? These are the list of the possibility treatment that we can offer. One is watchful waiting, second is medicine, and third, of course, is a surgery. Okay, so in terms of treatment, all the patients with the low interest symptoms, we will assess, like previously, we show you the IPSS score, the score sheet that I will ask, and then we actually mark you under a mild, moderate, or severe symptoms. And for mild symptoms or no symptoms, most of the time we won't treat you, we just watchful waiting, meaning we will advise you for lifestyle if you have some voiding symptoms. Whereas for those patients who have a symptoms, we want to see what symptoms do you have. If you have a storage symptoms like a frequency, urgency, nocturia, we can give you a medication that can relax your bladder so that your bladder doesn't contract so frequently. If you don't have these symptoms, the next one we will see whether there is a risk of progression, such as your prostate gland is very big, more than 35 to 40 grams, or if your PSA is more than 1.5, your prostate is protruding into your bladder. All these things we can give you a medication. And what are those medications that we can give you? One is an alpha blocker. This alpha blocker is the commonest medication that we will offer to the patient. And the risk factor for this alpha blocker is probably can cause you to have a postural hypotension, means sometimes your blood pressure will drop if you suddenly stand up from sitting position. And therefore, we usually advise the patient to take at night. The other risk factor of this alpha blocker is you probably may have a retrograde ejaculation, means for the sperm unable to ejaculate forward but backward into the bladder. Usually it's not a problem, and it will remain inside the bladder, get diluted, and it will come out together with the urine. This is a 5-alpha reductase. Usually we are given to the patient with a larger prostate. The function of this medicine is to reduce the prostate size by about 1/3 of the size, about 33%. Therefore, usually I will prescribe for those patients who have a prostate gland more than 35 or 40 grams to be more effective. The problem with this medicine, it will take about 3 to 6 months for it to work, whereas alpha blocker only takes about 3 days for it to work. And the other medication that I can tell is storage symptoms, where there are two types, anticholinergic or beta-3 agonist. And this medication actually to relax your bladder. This anticholinergic medication is actually, there are side effects to it where you have a dry mouth or possibility bladder urinary retention. And the beta-3 agonist, the side effect would be hypertension and headache. For those patients who have actually associated with the erectile dysfunction, actually they can given the phosphodiesterase 5 inhibitor, such as a tadalafil 5 mg daily. It is one of the medication that is given for erectile dysfunction patient with a dose of 20 mg much higher. But this one is 5 mg daily. Okay, come to the surgery. What are the indications? For those patients who are not satisfied with medical treatment. And you have to understand that if you initiate this treatment, it's not something like you are having a common cold, that after 1 week of a treatment, your problem for the obstructive symptom or storage symptoms will be disappeared completely. And you have to understand when you are on this treatment, you have to take it very, very long terms, and possibility up to the extent where complication happen, that we need to do surgery, then only you need to stop the medication. Therefore, those patients who have actually mild symptoms, actually I would advise for a watchful waiting. Otherwise, you'll be in a very long period of time requiring this medication. What other complications that I have mentioned just now, like a urinary retention, bladder failure, recurrent infection, stone, renal impairment, and kidney failure, or hematuria, all these are the indication that we can offer surgery. Excuse me. What are the options available? if happen that your prostate gland is very small, we probably just incise the prostate, means like a bladder neck incision. Or we are doing a usual procedure that I do for the patient is a TURP, where I'm using bipolar with the enucleation method, where there is a scope actually entering through the penis into the prostate gland, and we scrape the prostate gland out. And as you can see from this description, actually there will be no any incision and from your external body. If at all your urethra is very narrow, or most of the time I will make an incision along the urethra so that the scope entering without causing damage to the urethra. Because the scope that we use for this patient is actually quite big for us to perform this procedure. Whereas open surgery, where there's an incision in the abdominal wall, is this two type of a surgery, more than 100 gram prostate. However, because of the technology is much more better now with our good video camera system, and also with the bipolar technique, that we doesn't need to have use the hypotonic saline like before. This open surgery become very rare because this open surgery causes a lot of bleeding. Okay, now come to the prostate cancer. And if you happen to have diagnosed as a prostate cancer, after all the assessment, and then we have checked your PSA is high, done a biopsy confirmed that it's a cancer, then we actually need to re-stratify and stage your cancer to see whether you actually need treatment or not. And these are the investigation we actually can do for you: the CT scan, bone scan, MRI, prostate or pelvis, or even a more later version one is a PSMA PET scan. Okay, as a general management for a prostate cancer or any other cancer, from the diagnosis, first we want to know the stage, whether you fall into a stage 1 to 3 or 4. Stage 1 to 3 are the cancer that we still can cure. Of course, the more later you come to get the diagnosis, the higher chance that the cancer will come back. If you diagnose at the stage 1 and then we treat it, the chances of the prostate cancer to come back is very low. Whereas if you diagnose to have a stage 4, where is in the prostate cancer means it's already spread to the lymph nodes, or it spreads to the other organ, bone, liver, lung, or brain, then it's considered a stage 4 cancer. And this patient, usually we will give a palliative treatment in terms of a hormonal therapy, that a 3-monthly injection, or doing a surgery to remove the testes. And whereas the curative treatment for this cancer, we can do either surgery or oncology in terms of the radiotherapy. Okay, so for those patients who are happen to diagnose the cancer early, means the prostate cancer is still localized, we will depend on the tumor factor and the patient factor, whether they have any comorbidity or the life expectancy. Comorbidity means they are actually safe to undergo a very high risk surgery. Then we can offer the following treatment: either active surveillance, surgery, or radiotherapy. And not many cancer actually we can do active surveillance. It's something like we tell you that you're having a cancer, but we doesn't need to do anything for you. Not many patients can actually accept that concept. But this prostate cancer is one of the cancer that we actually can do that. Maybe I can briefly explain to you. For the very low risk, that means after we diagnose prostate cancer, we stratify you as a very low risk. That means this prostate cancer grow very, very slow. And from this graph, this red line is a natural date, whereas this here is a cancer date. Because of the cancer of the very low risk cancer, it moves very slow, so you remain asymptomatic until you natural cause of death. Therefore, you doesn't need to have any treatment, where any treatment also they might have risk factor. Whereas low risk possibility, you doesn't need to do anything as well, because you might get into a symptomatic but also natural cause of death, and you did not suffer from metastatic or cancer death. Whereas intermediate risk, they move like a tiger, so they move much faster, and a lot of time you will end up metastatic, and actually you die either because of a natural death or cancer death. And the worst one is there's a very high risk, they move really fast, like a Black Panther. So you have, for this type of cancer, if you diagnose, we have to do surgery as soon as possible so that we can save you and prevent you from progress until become metastatic or cancer dead. Okay, what type of surgery that can be offered is actually open, laparoscopic, robotic. For all this, laparoscopy is rarely done because it requires a more specific technical skill, a more difficult. So over here in Malaysia, most of the people are doing open and robotic surgery. Myself is doing open surgery, and to compare between this open and robotic, the cancer outcome is about the same, but in terms of bleeding, probably will be more for the open technique. These are the picture that I'm performing a robotic, means open radical prostatectomy. These are the prostate gland that have been removed, which is a size about like a walnut. And these are the robotic assisted radical prostatectomy, where the surgeon is sitting in the console and with the assistant at the bedside with all the port that is inserted to operate and remove the prostate gland. If for you who don't want the risk factor from the surgery, the other option is radiation therapy, such as external beam or brachytherapy. Brachytherapy is one of the radiotherapy where they insert the radiotherapy seed into the prostate gland. And of course, the criteria for this brachytherapy is very low. Very specific, means a very localized prostate cancer only can use that. Otherwise, most of the time is external beam radiotherapy, and it's better is have a 3D conformer so that the cancer will be more focused in the prostate gland, and it doesn't have so much of a collateral damage as compared to the linear accelerator, which is an old model of a radiotherapy. Okay, what are the better steps to prostate health? Cultural protective factor for prostate cancer, as I mentioned before, exercise is very important, especially for those patients who is having a prostate cancer. They probably need to be on hormonal treatment. And this hormonal treatment actually can weaken the bone, muscle, and so on. So this exercise can improve the general health of the patient. And of course, if you are localized disease, and this exercise also can help you to protect the cancer better. Other than that, these are the some of the dietary factor that possibility can protect the prostate cancer, such as a low dietary fat, soya beans, green tea, or tomato. Before I end my slide, these are the take-home message. Do not think urinary symptoms as part of a normal aging process. If you have symptoms, better seek for treatment. Don't keep yourself suffering from these symptoms. Seek treatment early so that we can help you to relieve the symptoms and to avoid irreversible complications such as bladder failure. And I would like to mention again, if bladder failure happen, then only we do surgery. Sometimes you may still need to be put on catheter because you can't empty your bladder completely. Next is a renal impairment. If you didn't treat early, you can end up with end-stage renal failure that requires dialysis. And if it is prostate cancer, we don't want to see you in the late stage. We want to diagnose early and treat early. And of course, to diagnose other possible causes that have similar prostate symptoms. Thank you.
Okay, thank you, Dr. Toh, for a very informative presentation. Okay, as to all the audiences, as Dr. Toh have mentioned, we have to check, do an earlier check for prevention of our prostate health, yeah, rather than allowing it to fester and become worse. As I can see, the procedures, if in later stages, is actually not very comfortable, yeah. So we have a lot of questions from our viewers today. Okay, one of the question is, can wearing tight pants cause prostate problems, doctor?
Not really. I don't think so. Wearing tight pants can cause prostate problem.
Okay. All right. Then next will be, may I know why American and African will have higher chance of getting prostate cancer? Is this due to their diet? Do you think?
Possibility of the westernized diet, or possibility because of a genetic factor that happen to be in the African Americans. That's why they are more common to have a higher risk factor.
I see. Next question, would prostate health index tell if there is prostate cancer?
Yeah, if that's prostate health index is one of markers for those patients who have a PSA between 4 to 10. And for those patients who is very reluctant to do prostate biopsy, because prostate biopsy actually also is a procedure that not completely safe. It can actually bring about 0.5 to 1% of a serious bleeding or serious infection that you need to be warded for IV antibiotic or blood transfusion. So some of the patients are very reluctant and afraid to do this biopsy. So they actually can be depends on this 5 score to actually tell you there is a chances of you having a prostate cancer or not. And from there is just another clue to tell us that is it safe for you to avoid biopsy. Okay, and you have to understand this 5 score is between 4 to 10. And if you can see from the explanation that I told you just now, like the low risk, moderate risk, and high risk, the low risk cancer is a PSA fall below 10. Okay, so if let's say we miss prostate cancer biopsy, confirm that you're having cancer, possibility you actually fall in the low risk. That's why the 5 score, we have to use it very carefully. And then, of course, if more than 10, anyhow, we can't do the 5 score. So more than 10, you probably, if you're cancer, you are already fall into moderate risk that you really need to have a treatment already. Okay. And of course, if let's say 4 to 10 and the digital rectal examination felt to be abnormal, I would advise strongly to do a biopsy rather than depending on the 5 score so much. Yeah.
Okay. In that case, the PSA, when do we do that?
Okay. PSA more than 4 is sign of a guideline to tell us that you required to do biopsy. Okay. Is kind of a cutting point, a cutting level from a lot of a population that they have do a study and the census to say that more than 4, the chances of picking up a prostate cancer is actually higher. And then, of course, below 4 doesn't mean that you don't have cancer completely. Therefore, if you come for a prostate health screening, all these things, we will usually do a digital rectal examination as well. And of course, prostate specific antigen, this antigen is specific to the prostate gland. Doesn't mean that your PSA is high, you definitely have a cancer. Any insult to your prostate, such as you are having infection, you're having inflammation, or even you're having a sexual intercourse, or vigorous, like let's say we do a digital examination, which is very rigorous, we press the prostate so hard, or even you are cycling, bicycle cycling, where the thing is pressing at your prostate, you also can release higher PSA level. So it's a prostate gland specific, but non-cancer specific. So if you are having more than 4, sometimes we advise you, doesn't mean that you definitely have a cancer. But if your prostate biopsy turned out to be negative, doesn't mean that you completely no cancer. So it's sometimes quite difficult to convince you that unless the result really tell you is that there's a cancer. If no cancer, I also can't really tell there's no, because as I told you, sometimes the biopsy, even the fusion biopsy, there's no 100%. Even because it's quite difficult. Sometimes the cancer can be hiding somewhere. It's just that it didn't target properly to actually diagnose you. If happens so, probably your prostate cancer are actually very small and minute. That's why the target is not able to reach.
I see. If that's the case, how often do you encourage your patients to do a check on their prostate?
Okay, that's why I mentioned if you're having symptoms, you can come much earlier. Otherwise, 50 years old is actually quite a good age for us to do the screening for you. Not only to check prostate cancer, but as well as prostate health. At least are you aware of what is actually the symptoms or not? Sometimes some people will really think that as you grow older, this is a common thing. Everyone have to suffer it when they are actually at the old age. But having said that, if you're taking the medicine doesn't cause you a lot of side effect, and actually you can pee a lot better. It doesn't when you pee better, you doesn't need to visit the toilet so much, and then you can sleep throughout the night. Actually can change a lot of your lifestyle and the quality of life.
Then would you recommend, if let's say there's no symptoms, for your patients to come in every maybe 6 months or 3 months or a year?
If there's no symptoms, actually, if you see once, I think it's good enough already. Unless you understand already, probably you can delay your screening a lot later. One of the PSA, we say the PSA kind of a screening. That's why we have to explain to the patient when we want to take the blood from you, because it can cause a lot of anxiety that we have to do the biopsy. Even though biopsy, we tell you, you probably still have, but we just didn't check it because it causes a lot of anxiety. And maybe we diagnose too much of early cancer that we treat you too much that you actually doesn't need any treatment. So that's why we have to inform them properly before we take the PSA screening. If at all your PSA is very normal at the age of 50, probably if you don't have any risk at all, the PSA you can take after 8 years also no problem.
Oh,
so it's really, it can be very long kind of a thing. That's why we have to really explain to the patient. But if at all your PSA is already high, that will be forever. We have to really closely follow up for you. At least 3-6 months, we have to check your blood. Whereas for the prostate symptoms, actually you can monitor yourself. You can see us once, and then you don't have a problem, and then we tell you you are having a mild symptoms. At least we tell you what is moderate symptoms. You feel like you come to moderate symptoms, you feel unsatisfied, you can always come back and see us again to get the medicine to treat it.
Okay, talking about medicine, there's a question from a viewer as well. Once diagnosed as BPH, we have to take the medicine for life?
Yeah, I have mentioned in my presentation just now, the BPH is something like, I actually call it the BPO. It's a prostate enlargement that causing obstruction. Okay, that means you're having symptoms. It's not something that common cold that you just give antibiotic, you will kill the bacteria, you will recover from that. This prostate enlargement, it will always be enlarged. So what medication you are taking? One is to relieve the smooth muscle of the prostate glands for you to ease the urination. If you stop taking the medication, it will reverse back to before. So you will experience the same thing again. So this is to answer to that, yes, you have to take it lifelong. Unless you are actually having a complication or side effect out of the medication, then probably you are unsatisfied or there's a problem with medication, then you have to choose whether to do surgery or not.
Okay, then there is another question, like most diseases, would like to know how to prevent prostate problems or cancer. So doctor, you have mentioned some of the diets that we can follow. What about other lifestyles?
Other than that, actually, in terms of a diet, like just now that I have mentioned, actually nothing much we can prevent. And the most important is if you're having a symptoms, probably you might need to have yourself a check. Okay, and then and then once it's checked, and then you have to follow the treatment accordingly. Whereas how to say, other than that, basically, you really have to come to see us to actually, at least we can screen you properly to see whether there is a problem with you or not.
I see. So no such things as exercises that we can do, or how to say?
Not really, actually, not really.
Not really, huh?
Yeah, there's no prevention. In fact, we just tell you that what are the risk factors that you actually had concern. that you actually really need to undergo this type of a screening. Those screening for normal people who don't have any family member having cancer actually are not necessary. But for the prostate symptoms, I have to mention it in a way that you have to separate the prostate problem, which is a prostate enlargement problem, and the prostate cancer. It's actually two different entities as my beginning of my presentation. Prostate cancer are those patients who actually having a family history and then all these things, they should actually do the screening for themselves, all these things. Whereas BPH is more about the symptoms. And these symptoms and the cancer, actually, there are no correlation. They have done the study already. There's no correlation. Yeah, in terms of prevention, not really so much. Even the diet that I mentioned just now, a lot of the study actually is just that some significant, some are not. You see, it's quite difficult to do a dietary kind of investigation to tell you how to protect or how to prevent a cancer.
But anyway, since there is no harm in doing that, just follow the diet will be a better option.
Yeah, exactly.
Yeah. Actually, I am actually quite interested if there's a radical prostatectomy after done, is there any effect on our life?
Okay, the radical prostatectomy, even how to say, there is a various of a side effect of a radical prostatectomy. One of the most people concerned is about incontinence. Means after the surgery, they can't control their urination. It will keep on leaking out. It can be from a very, very low that after they cough, they stand up from sitting, they leak a bit until it's worsening that continuously leaking. So that's something that the people are worried. So far, the case that I did so far is quite all right. A lot of them within 1 year is or within immediately or within a week they improve already. Then the other one is the stricture. Means they can't pass urine because of the place where they are sort of reconstruction to connect the urethra back to the bladder. That become very narrow, and this stricture causing them unable to pee. Usually these are quite easily manageable. We can actually do a dilatation or laser to actually open up the thing. Then they should be able to pee well again. And number 3 is a possibility of erectile dysfunction. These are the 3 common things that people are worried. Other than that is like other general operation is injury to the surrounding organ like the bowel or blood vessel, all these things.
There's another question. I think there's a lot of interest on the prostate cancer. Can prostate cancer be the cause of UTI, or maybe is it if a person is having UTI constantly, is it indication that he may have prostate cancer?
Not necessary, but prostate enlargement causing retention can cause UTI. Prostate enlargement because of prostate cancer can cause obstruction and again can cause UTI. So there is no real correlation in the fact of it's very difficult to tell that which one actually comes first. But most of the time is because of the prostate cancer where it's enlarged to the extent that actually obstructing the urinary outflow, same as a prostate enlargement from the benign causes, which is a BPH. That actually causing the retention, and this retention is actually the one that causing the urinary tract infection. So that urinary tract infection that causing the prostate cancer, not really.
I see. Okay, thank you very much, doctor. You have given us a lot of good information today.
Yep.
Indeed, I have learned a lot today, and I believe our audiences here have also learned a lot. So to our lovely participants, do stay until the end of the webinar session later, as we will be having a giveaway session. Let's say goodbye to Dr. Toh. Goodbye,
Okay.
Dr. Toh.
Thank you very much. Thank you, everyone. Bye-bye.